The tools required to perform this replacement are the spindle cleaning tool and the head cap wrench, both provided with your replacement parts, and a syringe at your dental unit. Be sure to wear exam gloves and remove the burr from your handpiece. Mark the head cap and the handpiece with a permanent marker before loosening the head cap. This is critical to assure that the head cap is tightened properly when the chuck is installed. Please note that if either ball bearing is damaged, we recommend that the parts which remained in the handpiece head or in the head cap are removed by a Lares authorized repair facility by means of a special tool. Use the head cap wrench and insert the tabs into the slots on the head cap with the thumb and the forefinger holding the head cap wrench. Turn counterclockwise until the threads are disengaged. Please note that the same force required to loosen the head cap should be used when tightening the cap during reassembly. Remove the head cap assembly, and if the entire turbine cartridge is removed from the head with the head cap assembly, gently grasp the turbine cartridge by the front end and separate the head cap from the turbine cartridge. Then, grasp the back end of the chuck by the stack of small spring washers and remove the entire chuck washer assembly from the center of the turbine cartridge. Discard the old chuck washer assembly. If the turbine remains in the handpiece head after removing the head cap assembly, do the following. First, grasp the back end of the chuck by the stack of small spring washers and remove the entire chuck washer assembly from the center of the turbine cartridge. Discard the old chuck washer assembly. Then, remove the entire turbine from the head. This is accomplished by pushing the burr end of the turbine cartridge spindle with the blunt end of a burr or other small instrument. Next, with the spindle cleaning tool fully inserted, make side contact with the internal surface of the spindle and then rotate the turbine blades between the thumb and forefinger 3 revolutions to scrape accumulated debris from internal surfaces of the spindle. Repeat this step until the tool is clean when removed from the spindle bore. Remove the spindle cleaning tool from the spindle and wipe debris from the tool, and then using a syringe, blow dry compressed air through the spindle bore to expel loose debris. Please be careful as this is an eye injury hazard. Safety glasses should always be worn when using compressed air to remove debris from the spindle. Apply handpiece conditioner to the entire area of the handpiece head and head cap interior. Then reinsert the turbine cartridge into the head until fully seated. Remove the new chuck from the protective plastic capsule, being careful not to remove or reposition curved spring washers. Then insert the end of the new chuck opposite the curved spring washers into the turbine cartridge and push with the thumb until it is fully inserted. Carefully return the head cap assembly to the position on the back of the turbine cartridge so that the head cap rests against the back of the head. Gently hold the head cap assembly and turn counterclockwise with light inward pressure until it is seated as indicated by a click sound. Then turn clockwise with light inward pressure until fully engaged. Using the head cap wrench, insert the tabs into the slots on the head cap. With the thumb and forefinger holding the head cap wrench, turn it clockwise until threads are fully tightened. Use the same force to tighten the head cap as was used to loosen it. Screw on the head cap with the wrench until it is tight and the marked lines meet. Engage a burr in the handpiece and move the burr in and out firmly several times to seat the turbine cartridge in the O-rings. Double check to make sure that the head cap has been fully tightened and that the marks on the head cap and housing line up. Warning: if the head cap is tightened improperly, in other words it's too loose, it may result in a turbine ejecting itself during use. Your handpiece is now ready to operate.